Hi all, I'm Dr. Archana Muralidharan. I'm a ENT consultant practicing in Bangalore. So today I'm here with a very interesting topic, BPPV in menopause. So what is BPPV? BPPV is Benign Paroxysmal Positional Vertigo. Vertigo means dizziness. So BPPV is a very common symptom which diagnosis which we see in our ENT practices. So the patient presents to us with a very severe giddiness. Entire world is rounding around them like a roller coaster. They are inside the roller coaster kind of a thing. So which is very common. If you take a dizziness as such, there are 20 to 30% of cases of dizziness will be BPPV. So it is very common entity for us. So if you take the ratio of women, like women to men, it will be 2:1, 3:1. That is very common in women. So what is the age group? So it is very common between the age of 40 to 60 years. So if you take the menopause on the other hand, the menopause will be the 45 to 55. So same age group, both the conditions can happen. So what is the connection between BPPV and menopause? BPPV. So why the BPPV happens? BPPV happens because of the otocorneal debris dislodging and entering into the semicircular canal. So these are the debris which are present on the otocorneal membrane inside the labyrinth. So for these debris to be healthy, we should have a very healthy calcium metabolism, because the calcium carbonate crystals, they are actually calcium carbonate crystals. The calcium and the bicarbonate concentration should be high inside the local area compared to the endolymph calcium. So calcium inside the endolymph of the labyrinth should be low. Then the excessive mineralization of the calcium will not take place. So why it is related to menopause? So if you take the menopause, why it happens? It happens because of steep decrease in the estrogens. So estrogen is a very important hormone for the women, especially during the reproductive ages. So it takes care of the reproductive organ functioning, processing, and also calcium metabolism. So when the estrogen declines, the calcium metabolism gets affected. So that is the relationship between the BPPV and the menopause. So how to treat it? So BPPV is a very simple problem for us, because as soon as we know that it is a BPPV, we diagnose it which side of the ear is affected by doing the Dix-Hallpik, and then we do the Eppler's maneuver, wherein we rotate the head of the patient and bring the otolithic debris which are there in the semicircular canal back to their normal position. So it will come back to the vestibules. That is very simple. Upon that we give the labyrinthine sedatives. But if you see your patient is having the menopause age, perimenopausal period or menopausal period, then you can add on the vitamin D and the calcium supplements, so that we can take care of the calcium metabolism. Apart from that, since the estrogen is going down in the body, we can add the hormone replacement therapy, wherein we give the estrogen supplements. So, but this HRT, the hormonal replacement therapies, can have some side effects. In such situation, we can use non-steroidal estrogens, that is phytoestrogens. They will mimic the action of our estrogen and help in maintaining the calcium metabolism. So whenever the menopause patient comes, we should think of all these things, because neurochemicals will be abnormal in each menopause women. So that is how in entirety we can treat the BPPV in case of menopause. So this brings to the end of my talk. Thank you very much.